let's be honest this morning. We celebrate nurses, yes, and we do have difficult conversations with them every single day, right? Why do some patients say that nurses can be dismissive, rude, or emotionally unavailable? Why do some people leave hospitals saying the treatment worked, but the experience was traumatizing? And on the other side, as society, do we really truly appreciate nurses for the exhaustion, the pressure that they put in, the long hours? Today's conversation is about the making of a good nurse. What actually goes into becoming one? Is nursing simply about medication and procedures, or is it about compassion and the importance of caring for people? Joining us this morning, we have Nurse Chichi. Hello, Nurse Chichi.
Hello, good morning.
Good morning and happy International Nursing Day to you.
Thank you so much.
How are you this lovely morning?
I'm very fine, thank you.
So today is International Nursing Day, right, like we said, and you were telling me that you started off this morning with a march. Before we get into anything further, what was the march about and how did that make you feel?
It made me feel really nice. It's been a long time since I showcased myself as a nurse. It felt nice because I felt connected to the people that we always attend to. By the way, my name's Achibuta Kantu. I'm coming from Skanze Police Hospital. I've worked in labor ward for 8 years. If you have delivered from there, you're definitely calling me Nurse Chichi or Chi.
8 years.
Yes, 8 years.
Wow,
of unbreakable service in labor.
Yes, that is really dedication.
Thank you.
Really dedication. So to begin with, right, for many people, nursing just looks like giving injections, taking vitals, handing out medication. But from the inside, as a nurse, right, what really goes into becoming a nurse?
So nursing is just not about training. It's also about compassion.
Yes.
So it takes about 3 to 4 years to train a nurse. So you can train a nurse, but you also need a nurse who has a heart, a nurse who is compassionate.
No, I believe that because, what is it? It's not everybody that can do everything in life, you know? People often say that nursing is a calling. So do you agree with that statement, or do you think it's just something you can learn and just do it?
So nursing is both skills. You can learn resuscitation, how to calculate drugs, and also how to make diagnosis.
Yes.
But you need compassion to be a nurse. That's why we say you need both. You can be taught how to do all these things, but if you don't have a compassion, you can't come out to be a true nurse.
I think compassion is a big part because as nurses, you are the first people that we see before we even go to the doctors. You know, you're the first person that we tell, okay, I'm not feeling well, I'm feeling this or this, you know. So compassion is a big part of it, right? Sure. So as we dive into this conversation, let's get a little bit uncomfortable, right? One of the biggest public complaints about hospitals is poor bedside manner with some nurses, right? Patients sometimes say nurses can be harsh, impatient, or cold. Do you think it's a real thing, or do you think like people over exaggerate sometimes, or have you actually seen it before with your own eyes where maybe your colleagues have been a little bit, impatient, or not impatient per se, or let's say a little bit, impatient with a person?
Let's be honest. It's a reality that some nurses can be harsh.
Yes.
But it's also a reality that some patients come with misconception. When they're starting off from home, all they're thinking about, I'm going to meet bad nurses.
Yes.
Because this is what they have in society. Yes. Even when they come across a good nurse, they'll find a way to frustrate that nurse. But to be honest, as a nurse, you just have to be there. And there's a lot of work overload. You find that you've got one nurse against 30 patients. So that will burn you out.
Well. Yes, I wanted to bring that up. But people tend to forget that hospitals in general are understaffed. So the nurse is dealing maybe like one nurse to 8 patients. That's frustrating.
Very frustrating.
Yeah, very frustrating. And then also the thing of lack of resources. It can be a lot for one person to take, you know. Do you think burnout and poor working conditions, like we just mentioned, the lack of resources and facilities, contribute to that attitude, or should professionalism still remain a non-negotiable regardless of pressure?
Okay, so burnout is real. A hungry, exhausted nurse is human too, before they are even a nurse. But professionalism can't be compromised. So as a nurse, despite burnout, all these challenges that we face, we strive hard to provide professionalism to the people that we attend to. And we are trying, and we are trying.
You're trying. I think you tried, because just meeting you here, you came in with a smile. So I don't think you're one of those that they are complaining about.
I try. Actually, when you come to Scanza, the best thing we do is smile and smile.
Perfect. How dangerous can poor bedside manner actually be? Because some people think being cheerful is optional, but emotionally, mentally, and even physically, can a nurse's attitude affect a person's recovery?
First things first, mental health is very important.
Yeah.
So before you even do with science, before you even do with medication, it's the presence, the person that they see. As nurses, we are the last person they might see when they're dying, the first person they see when they're born, and we are the first person they see as hope to treatment. So once they look at us, we should show the hope before we even give medication. Actually, it works better, because some people come with their personal problems and they'll tell you they are sick. But once you take time to talk to them, you find out that actually what they had is not a sickness. They just wanted someone to talk to. Probably somebody who won't judge them. And we are urging on nurses to do that.
That's very true. I've had a couple of people sit in on the same segment, right? And the first thing that we always talk about is how people who work in healthcare have to be very understanding, compassionate, because people want somebody to talk to. You know, people are finding out they have HIV, they have syphilis, they have cancer. They need somebody who's going to, number one, listen to them without judging them. You know what I mean? Because it's scary. It's very scary. It's very, very scary. Because it's also easier for people to talk to a nurse than talking to their mother.
Very true.
You know, there are people listening right now who probably still remember one nurse who changed their life, maybe during childbirth, surgery, illnesses, or grief. Why do nurses leave such a lasting emotional imprint on patients?
So I'll take you back to the other question. The reason why nurses are blamed most of the times is because we are the people that are mostly there.
Yes.
You find that we spend most of the time with the patients. A doctor will come in, prescribe, and leave. A nurse will be there when everyone is gone.
Yes.
That's why we are the face of the hospital. And we leave a long impression on these patients because this is what they see. Remember that the more time you spend with someone, the more you get to know them and judge them.
Yes.
So that's why we say nurses should always show that face. That will help in either healing the patient or the patient still going back the same.
Yeah, because I think nurses also have a really big imprint of just that hospital in general. You know, if you just go to the one hospital and you have one bad nurse, you don't want to go back.
Very true.
You know, you'd rather go even to a hospital that's further away just for better service. Now let's celebrate the profession properly, right? Nurses are often the first people patients see and the last people that they remember. In many cases, they spend more time with patients than doctors do, and we just mentioned that, right? Do you think nurses receive enough recognition in Zambia?
That's a tricky and good one.
Answer with all honesty.
Okay.
All honesty.
In all honesty, I would say nurses, we don't receive as much recognition as possible.
I agree.
In terms of salaries, in terms of being recognized in higher position where we are supposed to be, everything is given to everybody else. But in turn, nurses are the last person to receive the correct incentives from the government, from institution, even from the people that we nurse around. We are the last people to be recognized, but the first people to be blamed.
I agree,
I think we are not recognized.
That, yes, I've noticed that, because that's the thing, you know, even just in schools, they'll tell you to become a doctor and not a nurse.
Very true.
Yeah, nobody praises that. Even just in families, they would praise the son or the daughter that becomes a doctor and not the daughter or the son that's a nurse.
That's the thing, forgetting that the nurse is there 24/7.
Exactly.
The first person you meet, the last person you meet.
Exactly. And even spends, like you said, spends more time in the hospital with the patients, you know. Now, please take us back into history a little, right? What did nursing in Zambia look like in earlier decades, especially around independence and the early development of our healthcare system in Zambia?
Okay, so we've moved from doctor's helper to professional nurses.
That's what they were called before?
Yes, before we used to be helpers. Whatever was said by the doctors,
Yes.
that was what was followed by nurses. But this time around, we've got nurses going all the way up to doctorate level.
Yes.
They are professors,
Yes.
and we are able to teach. We are able to hold higher positions we are also able to prescribe medications now to our patients. You can even give medications that you have prescribed. For example, I'll give you an example of my labor ward. You don't always have to wait for the doctor to come and prescribe magnesium sulfate to a patient who's fitting, because that would be incompetence. And the moment that you lose, you might lose the patient. So we go ahead and prescribe. I think nurses has evolved. We used to be helpers, now we've got our own independent profession and we can stand as professionals on our own.
I really like that. I'm actually so happy to hear that answer. That word of doctors helpers, I don't like that.
Very, very,
I
very.
don't like that word.
We are now able to stand on our own.
No, I think that's a really nice thing to hear and to see that as a group we have managed to grow.
We are even doing research now.
You know? Oh, that's so lovely. Wow. So who were some of the pioneers or early generation of Zambian nurses that helped shape the profession we see today? And the same thing that we're talking about, who helped us move from doctors, helpers into professional nurses?
So actually we've got Sister Chanda Mwamba, from the one who trained from UTH.
Yes.
And the first group that trained from UTH and the Mission Hospital, that's in 1960 and 1970s. So those guys, we appreciate them so much because they trained under very difficult circumstances.
Yes.
There were no gloves, there were a lot of patients, but they were persistent and they carried the profession with dignity. And we appreciate them for that.
And they were going through racism at the same time.
A lot of things.
Yeah. Do you think younger nurses today face different pressures compared to older generations, to the older generation of nurses?
So I think the presence of social media also has brought about difficulties, because a young nurse now is faced with social media, bullying and all those things. Unlike the older nurses had their privacy. They were not heard, they were just seen. But because you are young, you are in this Gen Z generation, you want to be seen and you want to be heard.
Yes.
And as a nurse, they say we just need to be seen, we don't need to be heard.
Oh my
so
gosh.
It's very difficult to balance the generation and the nursing profession. But believe me, we are working on that. Because we want nurses to only be heard, to only be seen and not heard.
I think that issue of social media is something I didn't even think of, but it's such a huge impact because it's impacted every single career now. It's changed because people want to post, people take videos at work, and you can't do that in the medical field. You can't take videos because you don't know who your patient is. You could be patient to the president and you can't tell people about that. And like you said, people now want to be seen and heard. Let me challenge you for a little bit, right? Okay. Some people say they are nurses who entered the profession, for job security rather than passion. And unfortunately, patients can feel the difference. Is that criticism fair?
So it's actually real.
Yeah.
So because nursing is marketable, as a nurse, you're an international profession.
Yes.
You can go abroad. You're accepted everywhere. If you train as a nurse in Zambia, you can work in UK as a nurse as well without going through any kind of training from that side. So most people might want to join this profession because of that.
And because of the income.
Because of the income that comes with it. And especially that it's the most hired profession at the moment, if I'm not wrong. Yes, so someone might join. But I must tell you that we have nurses, and you have one of them here that is holding nursing at heart. And the midwife at heart as well.
And a midwife as well. Oh,
yes.
Wow. That's so
cool. For me, I intend to go as far as I can take this nursing profession.
No, please. I think, and you're a good role model for the youth right now, you know. Should emotional intelligence and communication skills be tested more rigorously during nursing training and not just academic ability? So
as important as IQ is, EQ is very important as well. You might be intelligent at school, but you might fail to calm that mother who needs you at that moment. You might not be able to resuscitate that baby that needs resuscitation, the baby that needs to come back to life, because you don't have that emotion. You might just give up easily. So as much as you can be intelligent, as a nurse, you need emotions to be by your side as well. So it's skills plus emotion, IQ plus EQ. It makes a perfect nurse. And you know, that thing of, you mentioned bringing a baby back to life to resuscitate a baby. I actually watched a video last week of a nurse. So twins were born, right? Oh, yes. And the one was thriving and then the other one's like kind of stopped breathing and turned navy bluish.
and the nurse picked up the baby and literally brought the baby to life. Without, there was no machine, there was no anything, but just by like holding it and just like, I don't know, like patting the
So
baby.
we call that stimulation.
Yes,
You're stimulating
yes,
the baby.
Yes, and that's
so we call it stimulation.
It wasn't just physical or like the technicalities of it. There was a lot of emotion.
A lot of
Because
emotions.
I think if it was just technicalities, you'd say, okay, bring the thing to, I don't know, to do something to make them come to life. Whereas just used emotion and just, I don't know, like just resuscitated it.
Actually, as nurses, if you believe too much in machines, you'll find yourself in places where you not find any machines.
Yes.
So your emotions have to make you to go thinking. You have to put other people first before yourself.
Yes.
Before you even think of having that machine that you are going to use, you should also think of the emotions that you are putting in for the mother, for the baby, and that goes a long
way, right?
Yes.
There's also a growing conversation around social media exposing poor treatment in hospitals. Is public accountability necessary to improve healthcare culture, or does it unfairly shame already overwhelmed workers?
So accountability is necessary, very necessary, I must say. Patients deserve a voice as well, but fuming an overwhelmed nurse, a burnout nurse, I think that is very, very wrong, and that's injustice. So as much as we want to be heard as patients, please, fuming that nurse who's worked, who hasn't slept, who hasn't worked, is a bad way of trying to get your justice. There's always a better way to communicate. There's always a channel of communication in the hospital. If you feel your nurse is not getting you, please go to the next person. There's always an in charge, a supervisor. There are always offices that you can go to. Please, let's not fume our nurses out there. Let's resist camera pressure.
Yes. Back to our thing of social media. Social media right now is people are filming everything and anything. And I think it's totally unfair because like you said, if your nurse is not giving you what you need emotionally or just with the work ethic, whatever, surely you can go to the supervisor, you go to the next nurse instead of just filming immediately.
Very true.
You know, despite all the criticism and pressures, nurses continue to show up. Night shifts, emergency wards, labor rooms, clinic, rural postings, often under difficult conditions, right? As we commemorate International Nurses Day, what message would you like to give to nurses across Zambia who may feel unseen or underappreciated?
First things first, I would want to say Happy International Nurses Day. This is a noble profession to everyone that is a nurse. I say enjoy fully and enjoy and develop as a nurse. I want to say I see you. You night shifts that are done when you've got a patient at home, you've come for the night shift, you are having a fever, you have got a running stomach, but you still show up. You have absorbed some insults from the social media, especially the growing thing of people fuming. But I must say, the nurse out there, I see you, and we see you. The people see you. There are people that are seeing you out there and appreciating that nurse. Please keep up, and Happy International Nurses Day to you.
Very true. There are a lot of people, like we said, who don't appreciate nurses. But a lot of us do. I've got 3 people in my family, 4 people actually, who are nurses.
Oh, wonderful.
I might even just be next, who knows?
Please come and join us. But you're doing a good job here. You're putting us out there.
I'm trying.
Thank you.
So last but not least, right, in one sentence, what truly makes a good nurse?
So what makes a good nurse is a combination of skilled hands, a sharp mind, and a compassionate heart to restore both health and dignity of a patient.
Yes. What a powerful conversation we had, and thank you so much, Nurse Chichi. You've educated us and informed us and reminded us why it's important to appreciate our nurses, you know. Today reminds us that nursing is not just about medicine, it is about humanity. The best nurses don't only treat illnesses, but they restore dignity, calm, fear, and remind patients that they matter. To every nurse listening this morning, thank you for your sacrifices, the patience that you have with your patients, and the sleepless nights and the care you continue to give. So much. Thank you so much.
Thank you very much, and thank you for having me. I've enjoyed my Nurses Day because I took time to talk about my profession,
Yes.
and I took time to inform people out there to say nurses are there for you. Speak to them, smile with them. Maybe go with a smile. Then if they ever had, they might smile back.
Yes, that's very true. Don't just expect a smile, but you went there with a frown.
True.
You know?
You need to come smiling as well. Sometimes you try smiling to patients and they are just never smiling. Please smile to one nurse and make a difference.
Once again, happy International Nurses Day. The time is
Thank you.
11:39, and you are listening to Sky FM, the People's